Welcome to Destination Change, a podcast where we talk recovery, treatment, and more. I'm your host, Angie Fiedler-Sutton, with the National Behavioral Health Association Providers. I use she, her pronouns. Today's guest is Julie Seitz. Julie is a project director with the Impaired Driving Solutions, IDS, All Rise Division, providing training and technical assistance to the treatment court field. Julie joined IDS in 2018, bringing 20 years of experience working in the clinical sector and community program development. Before joining IDS, Julie was the clinical director of an internationally recognized treatment center, offering the entire continuum of clinical care, including a first-of-its-kind direct access opioid withdrawal unit, where she was the project lead. As a published author and clinician, she has spent the last 20 years of her career giving clients a voice. Her work with clients has focused feedback-informed research and outcome-driven practice. Julie is trained at the local, national, and international levels. Thanks for joining us today, Julie.
Thank you for having me.
I always like to start with origin questions. So how did you get into this field versus all the other job options that are out there?
I know it's one of my favorite questions. So I'm super glad you asked. I am a social worker by trade. I feel like it's important to start with, even back when I went to college, I didn't know what I wanted to do with my life, right? I thought I was going to be a nurse. I got into my first nursing class. Hard pass. Thanks for all the nursing folks out there. And so my advisor said, you should be a social worker. I get into the social work classes, did that. It was a natural fit. I did some really amazing internships, mostly medical social work. And then they said, go get a job, my parents. I was like, wait, what? And so here I was. And I thought I wanted to work with adolescents. I certainly was in the mental health work in the medical model of the hospitals. I was working in the medical social work clinics. And the organization that I worked for 20 years, the Center for Alcohol and Drug Treatment, was offering a position for an adolescent entry-level position in their adolescent substance use disorder program. And that's where I started. And Angie, it is where I found what I wanted to do forever. I had no clue. And I think that's like a testament to, when we're young, sometimes we know exactly what we're meant to do and go and do all those amazing things. But this pathway and this journey, I have found my calling. I have found my people. I have found my passion, and it has led me to here. I'm just jazzed about it. So that's how it all started.
Great. Let's talk a little bit about All Rise. Give me for those who may be unfamiliar with the program, kind of give me the elevator pitch of what the organization does.
The elevator pitch of All Rise. So we are formally the National Association of Drug Court Professionals. So a lot of folks would understand that from that perspective. We've been around for 30 years, and we are the leading organization for training, technical assistance, and all things drug treatment courts. I think if you can appreciate how the world is evolving, we were once really identified as drug treatment courts, and now we are really appreciating that we are more about treatment courts and recovery courts, and looking at this through a more, and I'm sure we'll talk about this, a recovery lens. So we provide all the training and technical assistance. We do a majority of the research on best practices for treatment courts and what's happening in our field. And so we are one of the largest agencies providing services to the thousands of treatment court programs in the United States and beyond, really.
Yeah. Like you said, this is definitely a podcast where we talk about recovery. In fact, the big push behind Destination Change is the idea of recovery as a journey, not a destination. That you can go, you can backtrack and you can have issues and keep going. So talk a little bit about, the work with recovery courts and what that does.
Yeah. And can we just appreciate how I think certainly the justice legal system and even some of the folks in the treatment systems are really starting to appreciate recovery and the recovery focus, as opposed to sort of this idea of it is a destination, it is a determination. And so the work that we're doing is really helping people understand that the recovery pathway, the recovery journey is multifaceted, it is complex, it is individualized, which can be very difficult when working in a justice legal system, if you can appreciate that. And so really it has been an honor and a pleasure to be in this field, really recognizing just the complexity of the folks that we're working with, but then also that their journeys can look so different And that is really what we spend an enormous amount of time training and teaching on, is what are effective treatment interventions. Some of the treatment works for some of the people some of the time. So what do we do when those pathways need to be shifted and redirect, or they aren't linear? Particularly in the treatment court systems, we tend to think linearly, time-driven, checkbox. And it has been a significant shift in focus of what we're doing, while appreciating the accountability and the supervision of our folks in the community, is how do we put them on these individual pathways that they can adhere to long after we're gone?
What would you say is the hardest part of your job?
It's a great question. So I think it is and remains sort of well, hey, you tell me, is it safe to talk about policies and practices and kind of some of I think sometimes it's very difficult for us to do amazing work and know what the evidence-based practices are out there when we have arbitrary requirements put on us. So I think the hardest part of the work that we do is when we end up with these arbitrary requirements that aren't allowing us to be as individualized as we need. If I can provide a couple examples of that. There are times when we work with states or programs or communities where they have a required set of hours, a required set of curriculum, a required set of fill in the blank, and it's not even based on what the clinical needs are, what the stage of change the client is in. So I think and that is definitely where I think our primary challenges lie, is that the intent is we want everybody to get evidence-based practices and we want them to get enough to find their recovery journey. But the impact is often these arbitrary requirements.
And then, of course, the opposite question: what is the easiest or your most enjoyable part of the job?
is and always has been the clients, the participants, the people that we get to serve, and having the honor of being a part of their journey in whatever capacity that is. When I was a clinician, it was always the easiest and the best part of my day was working with the clients. And to this day, we have alumni, we have participants that we get to, get engaged with when we're in the communities. And so that continues to be my easiest and favorite, working with the participants.
Now, like NBHAP, All Rise is a national organization, and I'm sure like NBHAP, you have to deal with the fact that, like you said, states are different. Every state has their own regulations and whatnot. How do you go about kind of coordinating that?
That's a really great question. So our training modules are really designed the national standards perspective, always digging from science and research, evidence-based practices. States tend to do the same, and then they tend to have some of their own requirements within that. What we do is we become as familiar with the state that we're working in or the community that we're working in when we go and do trainings and address it through that lens. And sometimes we encourage states to move and shift towards the national recommendations if they're conflicting.
Now, one of the things we also talk about a lot is, recovery capital and the idea that the importance of recovery capital in the recovery journey. Can you talk a little bit about that?
Absolutely. We've started to really emphasize the importance of recovery capital. And I think when I train on this, one of the things I say the most is that historically, when we come to and work with our folks in the field, whether it's treatment courts or even in clinical practice, all of our assessments are typically disorder, dysfunction, and problem-driven, right? And the beautiful thing about recovery capital is it really is about what people are coming to. It is a strength-based perspective. It is about what they already have and what they need to, initiate and sustain recovery. So we are taking it through this lens of what clients or what participants already have, what resiliencies already exist, and then where do we help them build upon that? So I think that's a huge shift for us, because when you look at power dynamics and how treatment courts, even sometimes treatment has taken this approach of I'm big, you're small, I'm right, you're wrong, and recovery capital shifts it to really appreciating what the client knows they already have and what they can build upon for their recovery journey. And of course, look at where they need to, expand or build their recovery capitals as well.
Mm-hmm. Now, in your bio, I mentioned that you have 20 years of experience. Obviously, 20 years is a lot of time. What would you say is some of the biggest changes that you've seen in the industry?
Oh, I think giving clients voice and choice. When I first started in this field, I wasn't quite interning. What do you call it? Kind of like a new counselor where you're shadowing and being trained in. And I was being trained in with a clinician who was great, and she was been in the field for a long time at that point in her career as well. Everybody had the same treatment plan. Didn't matter. Didn't matter why you came in, what you came in for, how you came in, what your goals were, what stage of change you were in. It didn't matter. Everybody had the same treatment plan. And I think the biggest change I've seen in the field is really starting to allow clients some of that autonomy and recognition that even when they maybe have pre-contemplation or this ambivalence of not wanting to change, we can still work with that. And that's perfectly normal. And that is part of what our job is as clinicians, is to help them gain insight, help them build the skills, right? So I think that's been, because I've been around for that long, right? So I think that's been one of the biggest shifts. And then really watching us evolve into a full continuum of care, and really right from intervention and prevention all the way to maintenance and everything in between, and really appreciating the complexities of the full continuum of care, and that people don't have to move through them linearly. Linear. Am I saying that right? Linearly. In
all
order.
Words are made up.
You're right. Yeah. So and that's been sort of a change, because it used to be, this is how many hours, this is what you do. And if you don't do it this way, the client's the failure. And I think we need to be, I'm really hoping we're shifting towards treatment agencies and providers are really looking at, there's something that we're missing in our program, in our interventions, that might better suit the client.
Well, and that leads into my next question, kind of not just trends, but where do you see the industry going in the next, as 5 years or so?
In my utopian world, or we're
either way.
let's do. I think it's going to be. I'm excited about where it's going. I think we are moving towards an integrated model, a truly integrated model. I'm hoping we are shifting from thinking about substance use disorders as an acute illness, meaning, you're diagnosed, you're treated, you're discharged, to a more chronic condition model where we are fully integrated into, making sure people know how to address and take care of their substance use disorders. Meaning, right now in our current systems, if I'm diagnosed with a substance use disorder, I need to go in, I need to get an evaluation, I need to meet medical criteria in order to get into a level of care, and it can be very onerous. And if it was treated more like a chronic condition, it would be like going to your primary doctor. When I'm feeling like I need to be seen for my symptoms, when I'm feeling like I'm becoming symptomatic or there's something off, we should just be able to go in and see our providers. And we aren't set up like that yet. So in my utopian world, and I think I know I'm not alone in this, which is the great news, is I think we need to shift to that more, how do we help people engage in meaningful, connected recovery within their recovery management, which is all the services, so that they can manage their recovery capital, which is what they have over the long term.
That is a great answer. Back to kind of the idea of recovery as a journey. Obviously, treatment court is just one of the many possible steps on the recovery journey. Mm-hmm. What would you say some of the barriers are for people to move forward in the recovery?
Well, I think some of the things that we were talking about in regards to how substance use is treated from an acute perspective. I mean, we have this idea, it is not entirely appreciated that recovery, when we look at the research and the data about that, it takes years and it can take multiple episodes like other chronic illnesses. And so I think we have this idea and stigma that still exists regarding about how people get services and treatment, and then what said treatment is supposed to do, right? It's still, and if this is too callous or too off-putting, we can take it out. But it's so like, go to treatment. It's what's behind the curtain. You know what I mean? And then when everybody comes out of treatment, everybody's just supposed to be better, as opposed to it really needs to be integrated in with people's families, communities, all the recovery capital components, right? And I just think we are still, we're getting there, but we're still appreciating that I think we have, society has expectations that people are supposed to be definitive in their decision, and that it's not more complicated than that.
Great. As your bio mentioned, you're a published author. Want to talk a little bit about what kind of things you've published?
Absolutely. So a number of years ago, I wish I could remember the exact date. So when I worked at the clinic in northern Minnesota that I got to work at, we did a ton of work with Dr. David B. Lee and Dr. Scott Miller. And one of the things that we brought into our clinic, and I think which changed my lens on how we work with folks, was called feedback-informed treatment or deliberate practice. And what that is an evidence-based practice that really is engaging people in how do we know what we're doing in this treatment right now is effective? Are the outcomes producing the intended outcomes? Is it positive? Is it negative? Or even null? Are we not having any outcomes? So we incorporated outcome measures in our clinical practices, including alliance measures. You know, one of the things that I think we can really appreciate is that one of the best predictors for positive outcomes in substance use and mental health treatment is a positive therapeutic alliance. We know that, right? But how do we measure it? So we did some beta testing on some tools for in group settings. Long story, even longer. We really incorporated the feedback-informed model and tools into our work. And because of the work we did, we were recognized for that. And I wrote some work. I've done some publications on that with Dr. Mee Lee. And so I've done some of that. We've done some writing on and publications for the American Bar Association on impaired driving and substance use disorders and effective treatment. So that's kind of some of the work that I've done.
Now, our audience is, a wide variety. We have everything from other clinicians to CEOs. So, one of the things I'd like to know for those who may do it, what are some of your suggestions for people or organizations that are working with treatment courts, how, to work better?
We hear that a lot. How do you work with the treatment courts? And that's a really great question because, the courts are, sort of have been this in their own silo for a long time, but truly to be, especially with treatment courts, for them to be effective, they really have to work collaboratively with their community partners. And so many of the people that they're seeing on the regular, whether it's through their regular systems or through treatment courts, are engaged in the services in the community. So I think the best thing, and this is what we do a ton to train and teach on, is about forming those collaborative partnerships in your community with your treatment providers, your social service systems, your recovery support systems, your recovery community organizations, so that when you are working with the folks, they have access to all the services and supports that they need.
Well, let's talk a little bit more about your training. Kind of give me, again, the elevator pitch of what kind of trainings you offer, how people can get involved, that kind of things.
Yep. So some of our primary trainings are foundational and operational tune-up trainings. So foundational trainings are 3-day trainings where the entire team, so comprised of a judge, a prosecutor, a defense attorney, treatment providers, case managers, coordinators, peer recovery specialists, law enforcement officers. And so that is the majority of our team. So when we look at it, that they all come together, they get 3 days of training on the adult treatment court best practice standards and how to put that into operation in day to day. And so that looks like, how do you develop a program with structure that meets the needs of the clients? How do you engage your community partners to make sure they're getting the services? How do you provide the appropriate supervision with probation and supervising officers to ensure community safety, right? So we do 3 days of training there, and then people leave that training ready to either start a treatment court, or they've had significant turnover in their team and they need the foundation foundational practices. Operational tune-up tends to be for those programs that have been operational for a while and need to come to a 2-day training on what's new. How do we revisit some of our policies and practices? And we bring in experts, subject matter experts from all over. We have hundreds of subject matter experts that we bring in from all over the United States to help facilitate these teams and develop their policies and their practices on site. And then we do a series of trainings depending on the year and how we go on practitioner trainings, diversity, equity, and inclusion. We have a law enforcement track. We do technical assistance where it can be a little bit more catered to individual needs of the communities. And then, of course, I don't know if I call it this. This might not be all RISE, but I call it this. The Peace de la Resistance is our annual training that we do. It's called RISE. It is our annual conference. This year it's in Kissimmee, Florida. And that is where we bring 7,000 practitioners, treatment court practitioners together annually, where there is it is one of the best conferences and schedules I've seen doing this kind of work for justice involved in substance use and effective treatment. So that is a little bit of what we do. We are a staff of about 50 and we are all out doing this full time.
I'm going to use this point to plug NBHAP that we do have a page of industry events. We do list your event among others. So if you're interested in learning more about that, you not only go to the All Rise, but you can go to the NBHAP website. Speaking of the All Rise website, you have an advocacy section. Let's talk a little bit about what kind of advocacy All Rise does.
Absolutely. So I think we are about, restorative justice and reform and really making sure that clients and participants have access to the services that they need. So we have spent, whether it's through publications, whether it's through research, whether it's through our training, an enormous amount of time advocating for the therapeutic jurisprudence of the work that we do. So we have podcasts ourselves, we have an All Rise magazine, we have all of our divisions that go out and do their own kind of targeted advocacy. The division that I work in, her driving solutions, we do advocacy for keeping our community safe while ensuring participants are receiving the services that they need, while looking at some of the policies and practices that could potentially be I don't want to say change, because I feel like that might just be indicative of all, but really looking at, is it best serving our community? So yeah, all of our divisions are working on advocacy.
Great. Now, like NBHAP, All Rise is a membership organization. What is your primary membership demographic?
Gosh, that's a great question. I don't know that I can answer that off the top of my head. I can only make assumptions. I don't know that I can answer that.
Or what kind of people make up, I guess, the membership?
Typically, it is those that are serving or understand, or whether it's through direct involvement in a treatment court, or they are community partners with treatment court programs. So that is typically who are, when I'm out there serving our members, they're in some way, shape, or form connected to a treatment court.
Why would someone want to join All Rise?
Well, I think, membership with All Rise is certainly something that I think we would want, if you want to consider, it provides you ongoing resources. It provides you with what's new and, certainly a connection. I think there's benefits to coming to our conference at a reduced membership price, but more importantly, just the engagement and the ability to be a part of one of the most significant movements in the justice legal system that is creating just an enormous pathway to change for those that are justice involved.
Now, as I mentioned, our audience is comprised of a bunch of people. So I always like to ask if someone wanted to get into working in the justice involved field, what would be some of your advice?
Well, great question. It might vary from community to community, but if you have a treatment court in your community, and most, I want to be careful on how I say this, most would allow you to engage in some conversations, maybe even observe a court session, not a staffing, a court session. And if you're interested in becoming involved, whether it's through providing services, whether it's becoming a team member, reaching out to the coordinators or the judge of the team to share about what you think you can bring to the program. And oftentimes, I mean, we've worked with programs that have just, their team is just expansive of all the resources that are available in their community, making sure that no stone goes unturned for what their clients have access to. And a lot of that has to do with the outreach and the inreach. So court programs outreaching to what's in their community, and then community programs inreaching to the courts.
Well, speaking of resources, I normally ask, what resources you use on a regular basis, but All Rise has their own resource section on the website. So talk a little bit about some of the resources All Rise offers.
I'm going to talk about one in particular, and I'm going to do this very deliberately and on purpose. The Adult Treatment Court Best Practice Standards is one of our primary resources. It has its own tab. When I go out and do trainings, one of the first things I ask our folks that we're training that are involved in treatment courts, have you read the Adult Treatment Court Best Practice Standards? And when I hear no, I encourage people, it is the primary thing. If you are going to be involved in a treatment court, please read the Adult Treatment Court Best Practice Standards. Now, can I appreciate that there's a lot to take in there? Absolutely. Absolutely. And like many of our college courses, or maybe some of the other readings that we do, take it in bite-sized pieces, however you need to do it. We offer a podcast, we offer trainings, we offer a couple different ways that we can digest the Adult Treatment Court Best Practice Standards. It is, not only do we have a ton of resources and literature and publications on nearly every topic in the treatment courts, but I have to emphasize the Adult Treatment Court Best Practice Standards is one of the primary resources on how to operate a treatment court. So I get emails, I get phone calls, I get texts, whatever it might be about, hey, what would you do in this circumstance? Or what about this? Or what's recommended? All these fill in the blanks. And every single time I reference the Adult Treatment Court Best Practice Standards because it's embedded in the research and it's embedded in practice.
Now, aside from the All Rise website, what kind of resources do you or the organization go to on a regular basis, would you say?
Oh, absolutely. So we regularly utilize SAMHSA, Substance Use Mental Health Service Administration, NIDA, National Institute of Drug Abuse, NADAC, National Association of NADAC. Now I'm forgetting the acronym, but making sure that we are relying on the field experts, the national experts that guide us in our best practices as well.
And then what kind of advice would you give yourself if you could travel back in time to when you were first starting?
I've been asked that question before. The thing that I never said no. Like, do you want to do this? Yeah. I mean, sure, I had trepidation or I had pause or, there was a lot of and questions, but looking back, never saying no to opportunity. And I would say to myself 20 years ago, don't hesitate. Just keep doing it. It has led me on this journey. I love this work. It is incredible. I'm passionate about it. It has been an honor to do what we do. And it has been just a joy being a part of a larger systems change to ensure that people are getting their needs met.
That is a perfect way to end this. Was there something that you thought I was going to ask but didn't, or that you wanted to talk about but we haven't?
I don't think so. What do you think?
I always give that option because inevitably there's always something that somebody, and every once in a while somebody's like, oh yeah, I wanted to talk about this. So I always want to make sure I give that option. Okay. Well, for those who may just be listening to this and not on the website, how can people get a hold of you or learn more about All Rise?
Absolutely. So www.allrise.org. And then in our resource tabs, you will see all of our different divisions. We have the Impaired Driving Solutions divisions, the Justice for Vets division, the Treatment Court Institute, and our newest division, the Center for Advancing Justice. All of those divisions are there to serve our communities and our treatment court communities. So that is an amazing resource. If you want to get a hold of me, my email and my contact is also there, Julie Seitz at allrise.org, jseitz@allrise.org.
Great. You've been listening to Destination Change. Our guest today was Julie Seitz. Thank you for being here. Our theme song is Sun Nation by Kitsa and used via a Creative Commons license by the Free Music Archive. Please consider rating and reviewing the podcast on Apple Podcasts so we can get more listeners. In the meantime, you can always see more about the podcast, including show notes and where else to listen, on our website, www.nbhap.org. If you have questions for the podcast, please email us at info@nbhap.org. Thanks for listening.